Hello, my name is Debbie Gore, and I'm the practice coordinator for the gastroenterology department at Riverbend Medical Group. Our gastroenterologists have performed colonoscopies here at Riverbend for over 20 years. In 2008, we proudly opened our new state-of-the-art endoscopy suite in the Chicopee office where most of our procedures are done. We boast a staff of specially trained and certified registered nurses who provide our patients with the highest standard of care possible. If your insurance requires you to have your colonoscopy in a hospital setting, our physicians have privileges at both Baystate and Mercy medical centers. Our gastroenterologists provide service for patients who have primary care providers at Riverbend, as well as those referred to us from the community. I would now like to introduce you to our gastroenterologists, Dr. Mark Hirschkorn and Dr. Stephen Samuels. All of our physicians are board certified with many years of experience. Dr. Sotelo speaks both English and Spanish. Dr. Samuels is now going to discuss the specifics of colonoscopy.
Hello, I'm Dr. Samuels. You're considering being screened for colon cancer, and I'd like to take just a few minutes to help you familiarize yourselves with the process and to discuss with you why I think it's so important. Colon cancer is the third most common type of cancer, after cancer of the lung and cancer of the breast. You have a 1 in 17 chance of ever getting colon cancer. If you catch colon cancer early, before there are symptoms, the cure rate approaches 90%. If you catch colon cancer later, after symptoms develop, the cure rate is only 40 to 50%. Moreover, colon cancer appears in a precursor form called a polyp. A polyp is a small, benign tumor of the colon. All colon cancers come from colon polyps, though not nearly all polyps become cancer. But studies show that by removing polyps, you greatly decrease the future risk of colon cancer. About 1/3 of the adult U.S. population harbors a polyp. Colon cancer is a rare disease before the age of 50, and that's why present recommendations are to begin colon cancer screening starting at around age 50. If you have a family history of colon cancer, then screening should begin earlier, in your 40s. It's interesting to note that colon cancer is one of only 3 cancers that have been shown scientifically to benefit from screening, the other 2 being cancer of the cervix of the uterus and breast cancer. Studies show that the best way to screen for colon cancer is with an examination called colonoscopy. Colonoscopy is superior to X-ray studies in that it picks up more polyps than do X-rays, and unlike X-rays, colonoscopy allows for removing those polyps at the same sitting. Here's how I do colonoscopy. You would either come here to the Riverbend office in Chicopee or to Mercy Hospital or Baystate Medical Center as an outpatient, depending on our schedules and on your medical insurance. A nurse would then begin an intravenous line through which I would give you medicine to make you drowsy. You don't go to sleep, but you go into la-la land a little bit. A lot of people think they were asleep, but they weren't. It's just that the medicine can cause amnesia. I remember when I had my screening colonoscopy, I was told I was talking the whole time, but I don't remember a darn thing about it. After you've received the medicine, I then look through the rectum with a flexible tube with a television camera on the end of it. As you can see, the tube can conform to the configuration of your colon, which sort of makes an inverted U, although all colons are different. I guide the instrument through the colon on a television screen, and I look for polyps. And if I see a polyp, I can remove it using electrocautery right then and there. I can also take biopsies, little snips of tissue from the inner lining of the colon to be looked at under the microscope. Colonoscopy takes ballpark 20 minutes to do. Sometimes it only takes 10 minutes. Sometimes it takes longer, depending on what I find along the way and how easy it is to get through your colon, because everybody's colon is different. It's a crampy procedure. There's no getting around it. Some people have very little cramping, and some people have more cramping, depending on the nature of your colon and on your personal tolerance. But that's why I give medicine through a vein to make you drowsy and to take the edge off of the procedure. Afterwards, you would stay in the recovery room for about an hour to recover from the medicine before going home. You need a ride home, someone responsible, not a cab, to see you to your door, and I'd ask that you not drive yourself that day, no alcohol that day, take it easy that day. The next day is a normal day. You could go back to work the following day. You'd be able to eat normally once you get home. The risks of colonoscopy are fairly rare. Please understand that any medical procedure or taking any medicine entails a certain risk. Rarely there can be a reaction to the medicine I give you to make you drowsy, and that's why I monitor your heart, your blood pressure, and your breathing during the examination. You're wired up. Uncommonly, there can be bleeding if I have to remove a polyp using electrocautery. In that event, occasionally blood transfusions are needed. Rarely, in about 1 in 1,000 colonoscopies, there may be a rupture or perforation of the colon. In that unlikely event, surgery would be necessary, and very rarely a bag. I hope this discussion has been useful. My colleagues and I would certainly be very happy to entertain any of your questions, so don't hesitate to contact us. And good luck.
There are 4 important points you need to consider. First, your health insurance. Call the 800 number on your insurance card. This is very important. Ask the following questions. I booked my colonoscopy at Riverbend Medical Group. Will it be covered? Do I have a copayment? How much will that be? Do I have a deductible to meet? And how much is that? You are responsible for any cost not covered by your insurance. The second is your prescription. Obtain the cleansing preparation from your pharmacy at least 2 days before your exam. Third is your diet. You will need to follow a clear liquid diet for 24 hours before your exam. Fourth is transportation home. Make sure your transportation home has been arranged if you do not have a ride home, we will have to cancel your procedure. I'd now like to introduce Ruth Haley, RN. She's the clinical supervisor of our gastroenterology department at Riverbend Medical Group.
Hello, I'm going to be going over your preparation for your colonoscopy. First, I'd like to begin with special medication instructions. There are 4 groups of medications that will need to be addressed. 1 week before your procedure, you will need to stop all iron products. These might say ferrous sulfate. If you have any questions regarding any medications, check with your pharmacist. Also, any blood thinners. This includes Agronox, Pleadel, Plavix. If you have any questions regarding your medications, check with your pharmacist. There is one special consideration. If you're taking Plavix or Ticlid and aspirin, you will stop the Plavix and Ticlid, but continue to take your aspirin. For patients who take Coumadin or warfarin, we will be speaking with your primary care provider. Your medical record will be reviewed, and we will contact you with specific instructions. These instructions will be mailed to you before the procedure. Continue to take all of your other daily medications. This includes blood pressure, seizure medication, heart, and cholesterol medicines. 24 hours before your examination, you will need to follow a clear liquid diet. This will include things such as clear broth or bouillon, clear fruit juices without pulp, coffee or tea without milk or cream, Gatorade, carbonated or non-carbonated drinks, Kool-Aid or other fruit-flavored drinks, Jell-O without added fruit or topping, ice popsicles, and Italian ice. Things that are not allowed are milk products, solid foods, and alcoholic beverages. We also ask that you not take anything with red dye as it can impact the exam. Do not use sugar-free products. This includes if you are diabetic. It's very important. These are the only calories that you will take in today. If you're diabetic, you should have received a special diabetic instruction sheet. Please follow this. It will advise you regarding your diabetic medications and your specific type of insulin. Make sure that you check your blood sugar 3 to 4 times a day. If your sugar should drop below 70, you can elevate them with drinking something as apple juice or ginger ale. Again, make sure that they are not sugar-free. In order for the doctor to visualize your colon, you will need to drink a cleansing solution, which will cause diarrhea. This is a 1-gallon solution called Go Lightly. On the morning before your procedure, mix the solution according to the directions. You may choose to refrigerate it or keep it at room temperature. You will be instructed when to take the first dose of Go Lightly. Drink 1 glassful every 15 minutes until half the gallon is gone. It is important to continue drinking other liquids in between, and remember, no red products. Take the second half of your Go Lightly at the time directed, which will be several hours later. Again, 1 glassful every 15 minutes until the rest of the gallon is gone. Some people find that adding flavoring to each glass makes it more enjoyable, something such as iced tea mix or Kool-Aid. Also, others have recommended using a straw to make it easier to drink. Individual results to laxatives do vary. This often works in 30 minutes, but it may take as long as 3 hours. Remain within easy reach of a bathroom. For the day of your colonoscopy, remember nothing to drink for at least 3 hours prior to your exam. If you're diabetic, test your blood sugars. If you take medication for blood pressure, heart problems, anti-seizure, take your usual morning dose with a few sips of water. And if you use an inhaler, please bring it with you to your appointment. Do not take any diabetic medications. Arrive for the colonoscopy 15 minutes before your scheduled appointment time. Check in at the Gastroenterology Adult South Reception Desk in the Chicopee office, and plan to be with us for about 1.5 hours. Remember, you must have someone to drive you home. If you do not have a reliable, able-bodied driver, your test will be canceled. For your examination, a nurse will begin by taking your blood pressure and reviewing some medical information. They will then escort you to the clinical area, where you will change into a gown and be placed on a stretcher. Your personal belongings stay with you throughout the procedure. A registered nurse will start an IV, and next you will be brought into the procedure room. The nurse will connect you to monitoring equipment, and there you will meet your doctor. Medications will then be administered through the IV line. The medication used may be Versed, which will make you sleepy, and Demerol or fentanyl, which will keep you comfortable. These medications are considered conscious sedation, not general anesthesia. Typically, the next thing you remember is waking up in the recovery area, asking the staff when the procedure will begin. The medications are that good. You will remain in our recovery area for about a half an hour. We will review your home instructions and procedure results, and then you will be discharged. Remember, you will need an escort to bring you home. This should be someone reliable, over the age of 18, who is able to assist you in getting into your home and settled. They do not need to stay here during your examination, but if they choose to leave, please have them return 1 hour after your appointment time. For the remainder of the day, relax. No working or signing legal papers, no driving, no drinking alcohol, no strenuous activities, no cooking or cleaning, no operating machinery. You can begin eating your usual foods, and your doctor will discuss any special instructions with you before you leave. The day after your procedure, you can return to your regular activities. Remember, read and follow all of your instruction packet. Check with your health insurance company to verify benefits for the colonoscopy. Pick up your prescription for Go Lightly from the pharmacy at least 2 days before your procedure. Follow a clear liquid diet at least 24 hours before your exam, and make sure that you have someone to drive you home. Thank you for visiting our office. We will now be scheduling your colonoscopy appointment. Remember, if you are unable to keep your appointment for any reason, please call our office 3 to 4 days in advance. Also, feel free to call us with any questions or problems that you may have. We look forward to seeing you.